name is Boyd Bills, DPM. I grew up in Ohio, so when I was looking for podiatry schools, there was this college called the Ohio College of Foot and Ankle Surgery, and I was like, that's me. So I went to podiatry school in Cleveland, Ohio, trained there, learned a lot of things. One of the best experiences and also the worst experience I had was after graduating, I didn't match into residency. So it really put a load on my shoulders of, hey, you don't have a job and you just spent $350,000. So what do you want to do next? There's a gentleman in the Cleveland Clinic. So I trained at the Cleveland Clinic in their podiatry program and also with their vascular program. And so, yeah, it's like a wonderful experience. It's to be in that level of medicine. Even though it was on a volunteer basis, I was really well trained. And then from there, I went off to Chicago for my residency. I worked really hard to get a residency spot. Chicago's an awesome city, and the people there were very unique. The hospital itself was very unique. So the zip code I was in was the second most diverse zip code in the U.S. So people would literally get off O'Hare, and whatever disease they had coming into the country, they would end up at our hospital. So we saw stuff that, the infection doctors were like, you only see this here, or you only see this over there. And so part of my training in multi-specialty was dealing with all sorts of problems from all around the world. So yeah, it was a talk about learning through diversity in a neighborhood of diversity. Most of my patients didn't speak English, so you had to learn how to treat with a language barrier. And yeah, it's very different trying to treat somebody over the phone, right? So I responded to a job online. There was a listing, and so I took it, and I've really enjoyed the people here. Again, this is another town where people know how to live in diversity. They know how to live where you come from different backgrounds, different skin colors, different cultures, and they've melded really well. And so I've found that very enjoyable while living here in San Antonio, because it has that interesting history of we were this and we were that, and now we're Texas. Honestly, that's been one of the neatest things about going to practice for myself, is developing those relationships with my patients and seeing them be like, hey, look, you did this for me. I've got one patient. She's like, yeah. So she was born with a birth defect. One leg was shorter than the other. So she's been through dozens of surgeries to get her leg in a position to where she could walk. So she had to wear a lift, though, for the last 30 years, a lift like this. And she's like, after surgery with you, where I straightened her out her ankle so it was straight, 90 degrees. She's like, after seeing you, I bought 30 different pairs of shoes, right? Right. Ankle's a little different. Usually there's trauma involved, and it's as simple as an ankle sprain. The ankle does a really good job on its own when it's not injured. It pretty much will last your entire life. But if you sprain your ankle and then there's a shift or some loosening of the joint, or especially if you break your ankle, there's a shift in the joint and it causes the cartilage to wear. So what we typically tell people is, hey, we tried just cleaning up the joint first, but if you've gone through those other procedures, or you've gone through other conservative treatments, boots, braces, orthotics, and your ankle is still killing you and the cartilage is gone, that's when we start talking, let's replace the cartilage with metal. Metal is a lot less painful when it grinds against each other, right? One of the other things that drew me to the clinic that I was working at, that doctor does a great job treating neuropathy. And so I benefited from his training. So it's become one of my expertise as well. So the constant burning, the nagging of neuropathy, oftentimes related to diabetes, but not necessarily 100% of the time it's the case. So when people get burning, tingling in their feet, there are lots of things you can do for it. And there's anything from vitamins all the way up to surgeries. And I've learned, the nuances of when conservative treatment works the best versus when surgical treatments work the best for patients, and we work through those things.